Did you know the people with hypertension are 300% more likely to suffer an acute myocardial infarction in the morning than at night? One reason for this is morning surge, the period between 6 am and 10 am when a rapid rise in blood pressure can occur. Although studies have shown that it's normal for blood pressure to dip during sleep and gradually rise early in the morning, this morning surge in the blood pressure is very dangerous for hypertensive patients, with levels reaching a peak 2 to 4 hours after waking. For hypertensive patients, 24-hour blood pressure control is essential because their risk of having stroke can increase by 22% in the morning. In fact, 44% ischemic strokes tend to occur between the hours of 6 am and 12 pm. Morning surge also causes other life-threatening cardiovascular events. To ensure 24-hour blood pressure control, use a long-acting hypertensive agent that will give patients the security of being covered all day and night, even in those dangerous morning hours. Guarding against morning surge with a treatment that offers around-the-clock coverage means patients are protected even when they are most vulnerable.